I just want to remember the question that was sent in, Matthew Davis sent in earlier on, which was about adverse effects.
Yeah.
There was more to it than that, which was about how long does it take a patient to recover from the potential adverse effects? How do you justify your clinical thinking if that does happen? And again, we're all very conscious about
unfortunately, in general practice, I don't have the figures that you're looking for in regards of adverse events, but in the NHS we do. And in the clinics we're running, say the hand therapy at St Thomas's, they're doing 6 days a week, 12 patients per laser. And on average, they have, it's down to 0.001% adverse events, which is pretty low, really, seeing that the patients there are tertiary and they've got very severe chronic conditions.
I imagine, I don't know what the statistics are for other interventions, but I imagine
it's one of the lowest in the whole of their 400 departments, and it's the highest compliance of every department as well. So the patients enjoy the sensation, as Andy was talking about, and they feel the difference, and therefore are more likely to come, whether it's 20 minutes or whether it's an hour drive to go and get to the location.
Yeah. I'm glad I haven't completely alienated my osteopathic brethren here, because I've got a comment from somebody, unknown, who says, contrary indications to where you can use it, which I think we've covered. I mean, you're not going to shine it directly into people's eyes, but other than that, you're...
Thyroid? Because it's a biostimulator, unless you're suffering from hypothyroidism, I wouldn't advise to do that location. But you could still go and treat the neck without having to go and do that area. I still, if any, we have a lot of conversations. I mean, Andy emails me, but all clinicians over the UK email me about certain specific conditions. If there was a cancer patient, I definitely wouldn't jump in there. I would make sure that you've got their consent. We can present them with papers, and then it's a calculated risk, in regards of whether they're willing to proceed with that and that condition.
But of course that applies to every patient.
I would be cautious with pregnant ladies, treating them. I would do their carpal tunnel, I would do their ankle swellings, but I would not go around their lower back, unfortunately, until they've had the child. Right. Because although we believe there shouldn't be a risk, it is a biostimulator, and I wouldn't want to go and cause any problems.
And we've had numerous discussions with the obstetric types on this program, and of course there are various stages in a pregnancy where there is a high risk, and it's not all in the first 3 months.
Yeah.
And if something goes wrong and you've been doing something with the patient, there's a good chance you're going to get blamed, so it's best just to steer away, isn't
Understood.
it?
I have seen in the last 5 years a big growth of maternal osteopaths, though, especially treating people post-childbirth, and in that case we've been used because, as you were saying, from Tim Watson, it works very well on the skin, and therefore a lot of unfortunate tears and other lesions that happen during the childbirth period, they're using at that point in time to minimise the scarring and accelerate the healing.
Actually, can you bring up that diabetic foot slide that you've got here? Because first of all, it's a nice gruesome slide, unless you like feet. But also, what struck me about this particular image is that you've got a hefty wound in one foot, and we're talking about, 2 weeks between those two images, and the wound is virtually gone. Yeah. And that's after 3 sessions with a laser. 3 sessions. With any other interventions? I mean, presumably it's been dressed and antibiotic.
It would have had, I mean, this is, again, ironically on the same floor, they have the hand therapy and they have the diabetic ward on the same floor. Yeah. And so initially we were running between the two very early on. But in this case here, we published a paper from St Thomas's, which was in 2005, where 80% of the non-healing ulcers on the feet healed after 4.6 weeks with the K laser, and 0% healed with the placebo, which was no laser. But they had the same podiatrist, same drugs, same position on the foot.
So they were doing everything for the foot that they would normally have done.
All the silver dressings, all the weight-bearing bandages, everything possible to go and make sure that wound healed. And the only difference was the intervention of the laser at that point.